was, we are not supposed to write this way. We have to write the expanded way, that is 13th January 2011. Or if you wrote the other way, without comma and without th, in these two cases you are getting 1 point. Okay, you have a point. You have got 1 point. This is the correct one. Second one, the second mistake was, it was here. The C should be capital. So those who have written the C capital, they are getting the second score. Going to the third one, a comma is missing. A comma is missing here. So those who wrote with a comma, they are getting it. And if there is anybody here who thinks that comma, is it okay? Some people may be thinking comma, it's okay. Without comma also it is okay. It is okay only for you. OET people will cut it brutally. Okay. So you're getting the third score you're getting here. Yes, tell me. Yeah, tell me.
Please, is it necessary to write dear sir, stroke madam, or only dear sir, or only dear madam?
We don't know the one second. To whom are we writing this?
Like, yes, sir. I said this dear sir, stroke madam. Is it how we are supposed to be writing it, or we just take one of it, either sir or madam?
The problem is we have no idea about the recipient's name. The recipient's name is missing here. Okay, so the recipient's name is not there. Like no name is there. In such cases, what can we do? Usually OET will not give you this kind of questions. But if in case the recipient's name is not there, only the address is there, we don't know whether the recipient is a male or a female. So in that case, dear sir, madam is the best option.
Okay, sir.
All right. Okay, fine. Okay. So going to the next one, Mrs. This is a patient's name, Mavis, Brampton, 72 years old. Those who wrote old, they are losing the score.
Require.
Yeah, if you wrote old here, you lost. Those who removed this old, they are getting the score. The fourth point was about that. Then we have this one. We have to convert this into PRPDD. Yes, tell me.
Yeah, 72 years after that, do we have to put comma, or is that okay if you're not?
No, nothing is there. Nothing is there. There are like, for example, there is a colon here, colon, okay, a double dots, one above the other one. Here there is a semicolon here, one dot, and below that there is a comma, and after that there is nothing. There is nothing here. Okay. Now, so we have to convert this into PRPDD. What is PRPDD? We very well know. According to the PRPDD, we don't have to write I am writing. Okay, nothing is there. We also don't have to write refer. Why refer is not required? Because RE is all about refer. RE is refer. So everybody knows it is a referral letter. Every letter is a referral letter. Okay, even if it is a transfer or a discharge, it is a referral letter because the starting point we have very clearly mentioned it is RE letter. Okay, so according to the PRPDD method, Mr. Brampton, who is recovering from pleurisy, she requires, so we have to change it completely. P means patient, R means requires. What is she requiring? Yeah, requires
Continuing care and monitoring.
Monitoring as well as
monitoring. Okay, monitoring is, this is what she requires. She requires this one plus this one. Mrs. Brampton. Okay, here is something is missing here. The full name. Mavis Brampton. Because in the first part, okay, requires what? Continuing care and monitoring. Okay, but for what is not mentioned here. Okay, then P.
She is recovering from pleurisy.
Continuing care, sir.
We'll discuss that. Okay, she is
recovering from pleurisy and will be discharged in 2 days.
And will be discharged in 2 days.
In 2 days.
Almost done. So this is known as PRPDD. Anyway, I'm not going to give a long speech on PRPDD because you will really dislike my repetition of these things. So Mrs. Mavis Brampton, patient name P, requires R, continuing care and monitoring, P, purpose. She's recovering from pleurisy, and that is a discharge condition, and will be discharged in 2 days is the discharge date. So altogether, we call it PRPDD. Requires what? Continuing care and monitoring. Continuing or continued, there is no change at all. That's okay. She is recovering from pleurisy and will be discharged in. So this is all about.
Sir, after require continuing care and monitoring after recuperating from pleurisy, is that correct, sir?
Okay, Ranjita, once again, Mrs. Mavis Brampton requires continuing care and monitoring.
Continuing care and monitoring after recuperating from pleurisy.
No. That's not really good. Okay, this is the best way because we had. Yeah, once again.
Okay, sir.
Yeah, tell me.
She is recuperating after. Is that okay?
No, pleurisy. After will not come
After
here.
we are using for the surgery. No, sir.
Oh, one second. Pleurisy is a surgery.
Is recuperating.
No, sir. That is from.
No, sir, it is a problem.
It's a yeah. Oh my God. No, it's fine. Okay, I thought suddenly I thought pleurisy is a surgery or a procedure. Of course, pleurisy is a medical medical condition.
After. No, sir. Ranjita told after. So after we are using for the operation of surgery.
Right is a surgical intervention, because there's excessive fluid in the pleural cavity that needs to be drained out.
Okay.
Yes.
No, wait a second. What I understand is pleurisy is a medical condition and there is a procedure for pleurisy. What is the name of that? What is the name of the procedure?
Underwater sea drainage.
Pleural tapping.
Oh, fine.
Tapping,
Okay.
yes.
Oh, fine. Anyway, so
Pleural tapping.
yeah, fine. Anyway, there is no tapping is mentioned here. Therefore, the disease condition. So always remember from.
Sir, excuse me.
Yeah, please tell me.
Sir, we can write pleurisy and being discharged in 2 days like that.
Pleurisy. Will you please tell me?
She is recovering from pleurisy and being discharged in 2 days. Being B-E-I-N-G.
B-E-I-N-G?
Yeah. That we can.
No. And is being discharged in 2 days is okay. If you're writing being, but there should be is being is also there. Should be there. So pleurisy and is being discharged in 2 days is fine, no problem, because being is used for a future reference. Okay, we have discussed this one. So if you have written this way or with the being, that is also completely fine. So, but the most important part is, remember, from a disease condition, and after, if you're using after a procedure, that is a very important one, because the more grammatical mistakes you commit, you are getting a very bad impression from the assessor, because the assessor is neither a doctor nor a nurse. Okay, the doctor will be angry if you are administering a wrong medicine. The nurse will be angry if you are administering a wrong syringe or an injection. But the OET assessor will be angry if you are writing a wrong sentence or a wrong spelling. And OET assessors are English trainers, English teachers, and these teachers are very bad people. Always remember that.
Okay, sir. Thank you.
Okay, fine. Right. Okay, fine. So remember, we are moving to the, so those who have done this PR, yes, tell me.
Sir, scheduled, if we are writing scheduled, so what we have to use, sir, from or for, which one you can use, sir?
Her
scheduled for discharge today.
Has been scheduled. Always remember, her discharge has been scheduled is the only right way. Her discharge has been scheduled is correct, whereas she is scheduled for discharge is totally wrong. You know the reason? She is scheduled. Okay, you can use your mobile phone. You can take your mobile phone and you can schedule a date for any purpose. A schedule for a meeting with one of your friends, schedule for an appointment for one of your patients. But can you schedule somebody? Like there is Shibi in this class. Julie is her roommate, suppose. But they are friends. They are working in the same hospital. Can Shibi schedule Julie?
No, sir.
Because Julie is not a date. Julie is not an event. So she is scheduled is a very old method, very common method that is circulating among OET trainers and students. So please understand, these mistakes will be really backfiring and you'll be in real trouble. Okay, fine. Suppose you are writing she is scheduled. Okay, this is a grammatical mistake and nobody is going to cut your mark entirely. But if you commit such a small mistakes several times, the impression of the assessor will go down and down and down. This is the reason I tell you, be careful with the grammar. Okay, now we have to move to the next
So
area.
her,
Yeah.
sir,
Yeah, tell me.
she has been scheduled for or from, sir?
No,
From
her discharge has been scheduled. We never write she has been scheduled. Yeah, she has been
on.
Yeah, yeah.
Scheduled
Like
on.
remember, her discharge has been scheduled for 30th, 31st March or something like. The scheduled for is always important one. Some people also make a mistake like scheduled on. Scheduled on is wrong. Scheduled for is the right word. And okay, if you write on or for, nobody is going to mind it. Okay, don't worry about that. On and for, these are very small mistakes. Nobody is going to be angry with you. Or for or on, that's okay. But other mistakes like, these mistakes you should never commit. For example, she has been commenced. A serious mistake. She has been commenced. She has been started. Commenced is equal to what? Started.
Started.
Can you start a person?
No, sir.
No, sir.
Medicines has been.
Medicine, sir.
You can never. So her treatment has been commenced. Completely okay, no problem. Her treatment has been commenced or was commenced or is commenced, everything is fine because you can start a treatment. But she has been commenced is really so bad because you can never start her. She's not a machine. She's not a machine. He's not a machine. You cannot. Also, she has been prescribed is also a very serious mistake. I will be coming to these mistakes in the last week of the December batch. She has been prescribed. When we will discuss passive voice, we'll be having. So the last week will be passive voice. Don't forget that. Okay. She has been prescribed. You can never prescribe a patient. I mean, suppose we are talking about Amala. Amala has been prescribed. It is impossible because by whom? Amala has been prescribed by whom? By, of course, a doctor. So will the doctor prescribe medicines along with Amala?
No, sir.
Okay, you can write metformin. Metformin has been prescribed. We don't have to say by the doctor because everybody knows the nurse cannot prescribe. It is always the doctor. Okay, when you say, I have been taught, I have been trained, everybody knows trained by a trainer, not by a driver. A driver cannot, okay, a driver also can, but basically it is the duty of the trainer. So similarly, prescription is also done by a doctor. So metformin has been prescribed is completely fine. Metformin has been prescribed by the doctor. So how do we know? Because if you look at this one, see the doctor, let's read this back. Let's read this backward. The doctor prescribed metformin for somebody, for a patient. Okay, so listen here. Metformin has been prescribed or metformin was prescribed by the doctor. So the doctor prescribed what? Prescribed metformin for whom?
For the patient.
Okay, for the patient. For the patient. The patient is here. We know that it is always there. So patient is there, metformin is there, prescribed is there. Okay. So similarly, if you are writing, like if you are in the place of metformin, she, doctor prescribed she. Let's change this name to Anu. Okay, Anu Matthew. Anu Matthew. So the doctor prescribed Anu Matthew. That means if you are the patient, the doctor will prescribe. You take 3 medicines. You take 1 metformin daily, and 1 paracetamol daily, and take 1 Anu also daily. Is it possible you can eat Anu Matthew? Okay, I hope you got it. Okay, so these are the reasons why we shouldn't write these kinds of grammatical issues. 1 or 2 mistakes are okay, but repeatedly when you commit mistakes, they will be angry with you, and that anger is equal to losing score. Please, everybody, be silent. If you have any question, I'm sure some of you have not totally agreed with my explanation about this comments and prescription and other things. Okay, in the last week of this month, you'll understand everything more clearly. Okay, now we have to move to the next ones. Mrs. Brampton is admitted.
Was admitted.
Was is the only correct answer.
Yes.
On the 10th of this month and 10th January 2011.
10th
January
10th January 2011.
Yeah, some of you may be wondering why this was is the only correct one. Okay, is may not be correct, but then why can't has been be correct? The reason is whenever the time is mentioned in the same sentence, when a time is mentioned, you should always write the simple past tense, no has, no is. Remember, that is a rule. Okay, with the breathing difficulty and slight fever, after the chest x-ray, after a chest x-ray is the right word. Why? Because we always, yeah, A is the only right one. The is used to refer to something which is already mentioned. I repeat, the is used to refer to something which is already mentioned. And the chest x-ray is being mentioned for the first time in this letter. If the chest x-ray is going to be repeated anywhere in this same letter, after this point, you should write the x-ray or the chest x-ray. I'm sure some of you may not understand everything which I am telling here, but these are very, very important things. Confirming the diagnosis is the right word. Of course, you know, diagnosis is the right word. Okay. She, see, after a chest x-ray confirming the diagnosis, she comments she was commenced. No way. She was commenced is a very, very serious mistake. I know. Some of you cannot think differently. You may even leave this class. Some of you may even leave this class because I am saying some rubbishness. Was commenced, everybody says was commenced. But I am saying commenced. And that is the only correct answer. Don't worry, always. So please stop writing these passive voice. She was commenced or she has been commenced. Both of them completely incorrect. So you should write she commenced is simple. She commenced is equal to what? She started. That's all. Or if you want this, if anybody wants to write was commenced, amoxicillin and supplementary oxygen were commenced. Or was or were, both of them are completely fine. Was is also correct, were is also correct. I'll explain that later on. Anyway, remember, learning starts when you are confused. The first step of learning is confusion. And I am able to confuse you now with some of the grammatical things now. And please, if you are a beginner, don't feel negative. You may be feeling, oh my God, either this man is mad or I don't know any English. Okay, so you may be thinking that way. And please don't feel negative. Your English will be... Once again.
On the subsequent.
Okay, we're going to the next one, okay? Supplementary oxygen. On the subsequent days, we never write the with the subsequent days. On subsequent days. Okay, suppose you wrote the, you will not lose mark in the OET because they won't check it so deeply. Okay, if you want, you can write the, but I'm not going to give you score for the because we never write the and subsequent together. That means the will never come before subsequent. On subsequent days. Definitely a comma is mandatory here. A comma is mandatory. Okay. So she was developed and she developed. I'm sure 50% of you.
She developed.
I'm sure. Yeah, very good. But I'm sure many of you wrote was developed. If you want, if you're a very honest person, you can raise your hand. Those who wrote was developed, please raise your hands. If you are a very honest person, you can write. Very good, very good. Thank you, thank you. You don't have it. Okay, fine. So she developed is completely correct, and she was developed is another passive voice issue. So only she developed is the only one. She developed and she was developed. Okay, I will explain this one later on. Okay, but before that, tell me one thing. She recovered or she was recovered?
She recovered.
She recovered.
But some of you may be thinking she was recovered. Why? Okay, they think that it's a past tense. So many people think that for past tense, a was is mandatory. No, for past tense, a was is not really necessary because there is already ed is there. So whenever there is ed, remember, whenever there is an ed, ed means past tense. So you don't have to write another was, just like adding more sugar or more salt in the preparation so that nobody will complain. Okay. Okay, but the problem is if you add more sugar or more salt, you cannot do anything. But if you add less salt, you can add more and you can adjust it. But more salt will really ruin the preparation. So never write this she was recovered, because the reason is she was recovered. Is this action done by somebody or by herself?
Somebody.
No.
She was recovered. She was recovered means somebody recovered her.
No way. only some gods can do that. Only some gods can do that. Like for example, Jesus can go there. Oh, daughter, I am healing you. Come, rise, stand up. She was recovered by, but that is not recovered. That is healed by Jesus, healed by Buddha, healed by Krishna, something like that. So she recovered. Is recovery always happens naturally. No doctor in the world can recover a patient in the world. Nobody can. You can treat, you can administer medicines, you can advise, you can do every kind of treatment, but recovery is a natural process. I'm sure you are again confused, right?
No, sir. That's what only I told. She recovered means she herself recovered.
Yeah,
but
she
was recovered means somebody has to recover her. That is not possible.
That's not possible. Correct.
Yeah, that's what only I mean, sir.
I thought how you, Alfonso,
no.
Can say
the meaning
that, okay.
what I thought is exactly what I
Okay.
told you right now.
Okay, anyway, but the problem is there are maybe 50% of you who are really confused now. You know what happens at this point? Some of you may lose interest in my classes. I have always noticed this one. At this point, you will maybe at least 3 or 4 of you will decide and talk to their husbands today. This Viju sir is teaching something is wrong. No, everybody is saying that she was.
No, sir, the class is very informative.
Anyway,
Thank you.
Yes, sir. Class is very informative.
Every day we learn new things.
Yeah.
Sir, I'm enjoying.
Okay, very good. Thank you. Really. When you say you enjoy, I also enjoy that. Okay, very good. Okay, anyway, please.
We can educate this our children also.
I'm ready, but you know, yeah, really. Okay. I don't have to educate your children because you are getting very good English now. So you can simply teach them. You have learned some of my methods and you can also teach them. Okay, fine. So we are moving to the next area. Okay. So she was recovered and she recovered a different one. And nobody should be angry with me now because your score is going down and down and down. Okay. Now we're moving to the next one. Okay. Where are we? She developed.
Sir, here she developed, no, sir, correct?
Yeah, sorry, I made a mistake. She developed is a correct one. Okay. Yeah, a productive cough which was treated with pravastatin, I don't know, 20 milligram daily and yeah. Okay, anyway, whatever, I don't know. Okay. Yeah, so then there are two here, 100 milligram and 100 milligram coma, which is correct one. The second one is mandatory, okay, daily. Deep breathing exercises and
Sir, 1 minute, sir. Yeah. Then what about the previous? There was some 20 mg or something, no, sir? Why we are not putting comma there? If you are supposed to go putting comma there, we have to supposed to comma here also, no, sir?
Completely.
That's the reason I did not put.
Oh my God! So it is partially my mistake.
Yes, sir, the first one is
I
right.
didn't notice that.
No need of any.
So everybody is getting the score. Okay, you are getting the grace mark. Okay.
Okay, thank you.
Okay, all are getting the point. Okay, you are all getting the 14 is completely free for all of you. Okay,
Thank you, sir.
and you deserve it. You deserve it. It's not. I'm not giving it out of any sympathy, but it is you really deserve it. Okay, okay. Deep breathing exercises and non-smoking regime by with the help of.
With the help of.
With the help of nicotine.
Remember, by a person. She was treated by Dr. Sam, and she was treated with metformin or medicines. Okay, so with a thing and by a person. So here, of course, yeah, with is the correct one. The help of nicotine patches along with the Zyban. Okay, here also comma is required twice daily. Were or was thereafter initiated.
Was.
You are, those who have written was or were, you are getting the full score here. Were is also correct. Was is also correct. You know the reason? Somebody please, some noise from your side. I don't know, somebody's mic is. Okay, that's over now. So here, why were is also right, why was is also right. Because if you consider the medicine as two medicines here, okay, like two methods here, Zyban is also there, nicotine patch is also there. So there we can write were. If you consider them as separately, but if you are considering this as a course of medicine, we can consider it as was. So in this case, was and were are completely all right. Thereafter initiated.
So,
yeah.
Sir, before the class, you all told that along with will be present here. That means was required only. Yeah,
That's a good point. That's a good point you are saying. Okay, probably I didn't notice that one. Okay, 1 second. The help of nicotine patches. Patches is singular or plural?
Plural.
Oh my God. Patches along with, therefore, were is completely fine. Oh, it was a narrow escape. Mine is a narrow escape. Okay, I really escaped now. Just because this is a plural one, we are writing were here, and we are writing was here because even if that is plural, even if there is an along with, okay, it is like both of them are completely fine. Okay, now maybe some of you are a little bit confused about along with. Okay, suppose there are Alfie. I'm writing your name because it is easy to write because it's a smaller one. If I write Alphonse, it is a longer one. Okay, and if it is Kulvinder, it is also longer one. That's why I write Amala, Alfie, and all. Okay, and Alfie and Amala. Okay, Amala. Okay, sorry. Alfie, Amala, comma, along with Binu. Is it are or is? Alfie, Amala, along with Binu. See, look at before along with how many people are there?
Two.
After along with how many people are there?
One.
So we are only considering what is before along with. So how many are here? Two. Alfie plus Amala is equal to 2. Are coming to learn OET next week. So here R is completely correct. Alfie, Amala, along with Binu are coming to learn OET. Now I'm going to remove this Amala from here. Alfie, comma, along with Binu, is or are? Is coming to. Why? We are not going to give any importance to Binu. I'm sorry, Binu. Okay. It's not because of any other personal reason, but there is an along with in between you and Alfie. That's the reason. Okay. Otherwise, you will be important. Alfie, along with Binu, is coming to learn OET completely. Okay. Alfie, along with Binu and Bibin, is it R or is?
Is coming.
Is
coming.
Again, Binu and Bibin, I'm really sorry. Although you are two people, still you are not considered seriously, because along with means whatever comes after along with is almost negligible or not very important. Only alpha is important here. So the baby, remember, this is the reason why the baby along with her or his parents are, oh sorry, along with usually with the babies we say its, but okay, these days it's not is, her parents is or are, is or are,
Is.
okay, the baby along with her parents is being admitted. That is the reason for that. Okay, I hope it is more clear to you. Okay, so I think it is clear. So at the same time, if it is and the baby, no comma here, baby and her parents are being admitted. And if you're writing, changing this one with the as well as, the baby as well as her parents is. Yes, correct. I hope it is all clear to you.
Yes, sir.
Let's see, let's complete at least, what's the time now? I think you are not tired, I think. Okay. Okay, where are we? Daily. So that is the reason why here were is also correct, was is also correct. Okay. Thereafter initiated. A widow. The next is a widow.
This Zaiban.
How we do?
A widow. Somebody asked about Saiban.
Yeah, that's sir.
You're asking about a comma?
No, this is a trade name or a format name. That Z should be small or big.
No, there is no rule like that. If it is a trade name or a brand name, or if it is a category name, whatever it is, we always follow the small letter format is more common these days. But if you are ready to take a risk, you can do one thing. You can write capital letters for the medicines, but make sure that you will be careful with that one, because one of the problems is like if you're writing the name of Panadine Fort, is it okay or not?
Is it okay?
No.
Okay.
F
No, both of them are.
P.
Yeah.
Both
Even-
F for capital P.
That means P and F both should be capital. So if you have a habit of capitalizing medicine names, there's no issue at all, but you should be taking a risk here. One thing, you may make a mistake, like you will ignore one of the words, maybe small letter remain. Okay. The second problem is you sometimes may be confused between whether it is a brand name or a generic name. Generic name means analgesia is a generic name. Brand name is the medicine brand name. Okay, so if you can take that risk, you can. Otherwise, you can always write the small letters. There is no problem with the writing with a small letter. All right, I think it's clear to you. A widow, Mrs. Brampton, is socially
active.
Active. Okay, active. She has had. Whenever you're talking about habits, we always say she has a habit of. We never say has had. Has had is used for chronic disease conditions, like she has had diabetes. Okay, but for habits, we always write she has. And remember, some of you are habitually making a mistake, like a history of. Remember, don't commit this mistake at all. Whenever you write the word history, she has a history of. Always remember, she has a history of something, something, something. Never write she had a history. Is there anybody here who writes she had a history? Because history is already past tense. History is part of the past. So there is a logical thinking way that had is better than has. But remember, it's always has. Anybody has a question regarding this? Is it convincing, or do you want an example for this?
Yes, it's convincing.
No, sir, correct.
It's convincing, sir.
Okay, fine. So if anybody is here in this class who wants an explanation, who is not comfortable to ask questions publicly here, you can simply ask the same question in the group, in the main group, okay, so that I can write the answer there. She has a history of whatever it is. Never write she had a history. Never write she has had a history. These two things are completely wrong with the history. History means she has a history. Okay, moving to the next one. Okay, where are we? Okay, habit of smoking. Everybody knows it is smoking only, because the reason is we have to write ing form after these words of, by, from, on, in, after, before, with all these words. And these words are known as what? These words are known as, in English, these words are known as, yes, these words are known as prepositions. And you know, if you want, I can help you in a different way. All the prepositions, there are around 40 prepositions are there. Most of the prepositions, after prepositions, ing forms will come. And there is one preposition that will not change. That is to. Can you write a sentence, sorry, ing form after to? We can, but generally,
No,
we can. There is a rule like that. There is a recent trend for the last 15 years. There is a trend like, I like to going there. No, some people, Americans use that way. But anyway, we cannot use that. Habit of, okay, habit of smoking. Since the age of, since the age of. Definitely, since is always about the
since
starting.
the age of.
Okay, always remember 18 and her BMI is here. The second and with a comma is the correct one, because we are shifting the topic here. It's about the habit, and it's about her BMI. So BMI and habits are not really connected to each other. Okay, so since they are not connected, or they are not a continuation of the same thing, that's the reason we have a. So remember, there are two kinds of and, a normal and an and with a comma. Remember, a normal and, that means without comma, is used for combining two things. For example, Amala and Binu. Okay, Amala and Binu. Fine. This is it. So it is for, okay, or diet change, and exercise. In this case, we can use that one, diet change, DIET, diet change and exercise. Okay, so there we can write. Then where do we write diet change? Then a comma. So when this is not simply two things, two elements, but they are part of a long sentence. She needs a diet change immediately, and see, comma, and comma, she has to perform more exercise. Although there is a kind of a connection between both of them, still the and with a comma is the correct and here. So some people say, some trainers say, you cannot write two and in a sentence. Yes, really that is correct. Try to avoid writing more than one and in a sentence. But if you have to write one more and, there is no problem. You can write, you can replace that second and with along with, or you can write and with a comma. Please be silent, everybody. We have to reach at least, okay, let's see, let's try to conclude this one. Okay, it would be since, okay, it would be greatly, highly, or nothing. We don't require any of them. Yeah, nothing. Okay. Don't write, okay, hereafter, if anybody is having a habit of writing greatly or highly, just for this greatly, you will lose your OET exam. Greatly is so dangerous. So don't write these two words, highly or greatly. If you want to know the reason, you don't have to make such a deep request to another medical professional, because it is the duty of everybody. So you don't have to request, please doctor, please admit my patient, please doctor. We don't have to say that way. It is a responsibility of every medical professional to provide timely treatment for the patient. Appreciated or appreciable? Which one?
Appreciate.
It would be appreciable.
Appreciated.
Appreciated. Appreciated.
Appreciated is the most
Appreciated.
okay. And if you want appreciable, it is appreciable. It would be, it is appreciable will be fine. If you can and could.
If you could.
Yeah.
Could.
If you write can is impolite.
Be
To be
money.
polite.
It's not clear.
Somebody please, some of you are making some noise. Yes, Binu, I think it was from your side. Okay, maybe some kind of network issues. Okay, please be careful. Okay, if you could monitor.
Be monitor. Monitor her medication.
Monitor.
If you could monitor.
Monitor.
Okay, monitor her medications, medicinal. Medication, compliance or complaints. Compliance. And you know the meaning of compliance? Compliance means, yeah. Another word for compliance is adherence. Okay. Yeah, adherence. Okay. Compliance and cessation. Okay. Compliance is a noun form and cease is a verb form. Cessation is a noun form. So remember, in the same sentence, you cannot have one word as a noun form and another word as verb form is not allowed. You have to write. So once again, if you go back, medication, compliance, and cessation of smoking. And cease of smoking is not right here. Cessation is the correct one. She is recommended, advised, or advised. You know that we can never write advised. This is completely wrong. Because if you're writing the verb form, ed form, we can never write CE. CE is only for advice.
Recommended.
She is recommended also is wrong. We can never say she is recommended.
Yes.
She is
Advised.
Advised is only one. She is or she has been advised. Both of them are completely fine. Remember, whenever you want to write ed form with advice, remember it is SED. We never write CED. We never write advising, CING. We never write advices, CES. Okay, remember, if you want to convert this into use advice as a verb form, like advised, advising, advises, the S is the word, not C. Remember that. Okay, and we can never say she is recommended. How can you recommend a person here? She is recommended. Recommendation comes very rare cases, like when you are planning to get your sister married, or when you are planning to get your brother married. You can recommend a girl, or you can recommend a boy. So that is a she is recommended. Okay. Fine. To continue, nicotine patches and Zyban until smoking addiction has been, will be.
Will be.
Although you are thinking about the future tense, it will be has been. It will be has been only. You may be a little bit shocked here, but okay. If you write will be, it is not grammatically completely wrong. I mean, it's grammatically wrong, but they will ignore your mistake. So those who have written has been only will get the score here. Others will not. But for your understanding, will be okay. Will be okay. Okay. If side effects, everybody knows it is side effects. Other one is, another one is, okay, that's not the correct one. Side effects such as dry mouth and or difficulty in sleeping. So what will you go for? Or is the best one. Yes. You know why? I'll explain this one. Please give me maybe just less than 1 minute. I will explain that. Okay. See, side effects. That means if side effects, which are the side effects here? Dry mouth and difficulty in sleeping. That means stop Cyban. Okay, suppose our Anu Matthew is a nurse here. She has been specially advised by this writer of this letter. If these two things happen, only then Cyban, stop Cyban, right? So one night, she has this dry mouth was there, but there was no problem like a sleeping problem was not there. So will Anu Matthew stop Cyban or not?
Yes.
She has to, right?
Yes.
But then she can think this way. If she doesn't understand the difference here between and or, so she will think this way. Okay, she has dry mouth, but her sleeping is all right. So I'm not supposed to give Saiban, or I'm not supposed to stop Saiban. So or is the right word. That means there are two conditions, two abnormalities, and if one of them, if one of the two happens, then also Saiban should be stopped. Okay. So here, of course, why this is wrong? Stop Saiban is not really a polite way of writing. So we are changing this into passive voice. Saiban should be stopped here. Some of you may be thinking, can we use should in OET? You can write should, but you should never write should with a you should. Okay, you should not be written, but we are not talking to somebody you. There is no you here. Saiban should be stopped. So this is a right word. Okay, I don't know how to pronounce this word. Do you pronounce it as Saiban or something? What is it?
Saiban.
Oh, once again?
Ziban.
Ziban, my God. See, this is
Sir, what about 34?
34, where is it? 34?
34.
Occurs or occurs.
Okay, fine. Yeah, that's good. Such as dry mouth or. There is or here, remember. Or means whenever you say or, A or B. A or B is equal to what? What is the number? 1.
1.
A and B. What is the number? What's the number here? 2.
2.
So if it is 1, what we write? S form.
Require.
Occurs.
Okay,
Yeah,
very good,
that's
very
right.
good, very good. Okay, occurs. Occurs will be the correct word. If there is anybody in this class who is simply wondering and opening the mouth so wide that they don't understand and they are angry with those people who are answering very fast, please understand. You will have to take some more time. You will understand everybody because you know, some of the participants who are very active, okay, most of them came here with a good knowledge, but some of them improved a lot. So remember that. Okay, as soon as possible. She also requires assistance and assistance. Assistance.
First one.
Assistance. Assistance means, this one means the people. Assistance means the people who are doing the assistance. Assistance, okay. And you know the difference here, residence and residence. Residence and residence. What is the difference? Residents are people who live in a place called residence. So residence is a place. Residence is a place, whereas residents are the people who reside in residence. Okay, that's a good way. Okay, right. Now we are coming to the last ones. We are coming to the last part of it. Okay. In addition. Of course, we can never write in additionally. Okay. If you want, you can write. So otherwise, in addition is also fine. In addition, a comma is required. The best one is in addition to these is the best one. Or in addition is also kind of all right, because I have noticed that many people are writing in addition, comma. Without this comma, this is completely wrong. She will need assistance with shopping. Please contact me.
But here there is no comma. No, you did not put comma, no, sir. Addition.
There is a comma here. There is a comma.
No, in addition, comma.
Yeah. Yeah.
Ah, okay, okay. I did not see that. Okay, fine,
okay.
sir.
Please contact me for further queries or information.
Information.
Okay. So we know the reason why queries is an absolute joke. It's a joke. Okay, you know the joke. Okay, we have already laughed for this joke earlier. Okay. Yours faithfully or
Faithfully.
How to decide that? We have to go to the beginning part. Yeah.
Yes, sir. Or
yeah, if you're writing dear sir, dear doctor, dear nurse, dear sir, madam, whatever, we always end with yours faithfully. And if you're writing dear Alfonsa, dear Amala, dear Anu Matthew, in that case, yours sincerely. Okay.
sincerely.
Faithfully will be the correct word. And
Registered nurse. Just the registered nurse.
Yeah.
Not
The is not required here. Okay.
registered nurse.
Now it is time for us to see the score. How many of you got 35 and above?
34. I have 34, sir.
Okay, fine. Maybe that's not a problem, but still 35 is the number which I really want. 34 is okay, but the more grammatical mistakes that you commit, you are in danger.
Sir, first part, can you please show?
Okay, you want to see the first part? Okay, you can have a look at this one if you want. And that is the end of this class. And I have a request to all of you, those who did not get 35 and above, that means you are just a beginner. Okay, and you should be happy today. Why? Because you have realized that your grammar needs some kind of repair, some kind of uninstallation and reinstallation. And I'm here and I will teach you. So please continue your training. Do not feel disappointed because your score was less than 30 or 20 today, because you are just a beginner. That's all. Yeah. Tell me.
Thank you, sir. This class is very helpful for me because I have given 2 times, and
Okay.
I always wrote like what meant, was recommended.
Okay.
For me, and I hope now I will get good score.
Really, you will definitely get. Yeah. Tell me, somebody was asking. Yes, tell me.
Yeah. Sir, the 10th TH is required, sir. 10th January, 3rd January, like that. This TH in the word.
Like you're talking about this one?
No. 10th of this month. 10th January 2011 in the word. That is.
Will you please tell me the number? Number
7.
I think so.
Okay. 10th of this month. Okay. In this case,
10th January to
that 10th TH is required on the top.
Here,
Yeah.
you're talking about this one.
The green color, yes.
Yeah, 10th January without comma is also fine, or 10th January with comma is also completely fine. There's no problem at all.
Okay.
If we not put TH, there is any mistake, sir?
There's no problem. There's no problem.
Okay.
Okay. Any other confusion?
Sir,
Yeah. Once again. Okay. What was that, Mary?
Yes, sir. In PRPDD, sir, that
Okay.
requires continue care. Is it okay, or we need to write
Continuing care or continued care? Both
I
of
wrote
them are
continue
completely.
care and monitoring.
Continued care or continuing care or continuity of care. Continuity of care. These 3 things are completely fine. Anything else is completely wrong.
Okay, sir.
Especially continuous care. Continuous care is completely incorrect.
I wrote this continuity of care. That's why I was trying to ask.
Okay, fine, no problem. Please always be very open here, because we are after all only 43 participants or less than 60 or 70 participants in every class. And if you are hesitant, you will be always hesitant. Come on, you are nurses. You are on the top of the world, all of you.
So,
yeah.
Sir, if they give
Sir, excuse me.
I'm sorry, who is that? Two people are asking at the same time. Eldo?
Eldo here, sir. Yeah.
Eldo. Yeah.
Sir, is TH after that comma is mandatory, or?
Please specify the number, please. Which one? Number 1?
Date, sir. Yeah, first one.
You can just
TH,
give me the number.
Means, yeah, first one, sir.
Okay.
Yeah,
so,
TH, 13th January, comma is mandatory, or like that?
No, nothing is mandatory here, but both of them are completely fine. With TH and comma is also fine. Without TH and comma is also fine.
No, with the TH, comma is mandatory?
No, never. This is also completely fine.
Okay, sir. Thank you.
Okay. Yeah, I think Milka, you asked a question. Okay. Anybody else?
Sir, in 21, sir.
21.
That or and since I got confused, please explain
very
me,
simple.
sir.
Very simple.
21.
Yeah, 21. Okay, 4. We use for and since with these words like has been, or have been. Have been. She has been working in this hospital since 2020. She has been working in this hospital since 2020. The same thing can be written with the for also. For, but we cannot write for 2020. So this is 2022, right? So if a person joins a hospital by January 2020, so for the last 2 years. So this is a difference between since and for. So once again, if it is since, then write the starting point. Since January 2020, or she has been working in this hospital for the last 2 years. This is a difference between since and for. And you are asking about this question, the number 21, habit of smoking since the age of. Since the age of means is equal to since 2001 or 2000, since January. So since is always used with a starting point of time. For example, Mary, how long you have been studying from me? I have been, Mary?
Last month joined, sir.
Like last month means?
Yes, sir. Last month only I have joined.
Okay, that means November 1, right? November 1, okay. I've been
November 8. November 8.
November 8, okay, okay. I have been studying since November 8, 2022. That is a correct sentence, okay? With a since, okay? You know that N should be always capital and full November, okay. And if you don't want this, if you have any special issue with the since, you can write with the for also. I've been studying for the last what? November and December, right? No, December is just beginning, right? That means for the last 1 month. For the last 1 month, because it's almost the same thing, because you have completed 1 month course now. Okay, I've been studying for the last 1 month. The same thing can be rewritten as I have been studying since 8th November. Same thing only. Since and for
sir.
are same thing, but since is about the starting point,
Yes,
and for is about the duration. I think today's
Okay,
class
sir.
was
Thank you,
beneficial
sir.
for all of you. Anyway, so
Okay, thank
Yes,
you, sir.
yeah, okay, yeah.
Okay,
Very
my
good.
first online class is this one. So, I enjoy and it's more informative and very helpful to me.
Okay, fine. Very good, Binu. That's very good. Okay, because it is our family.